My name is Nalepa, A-N-N-E-N-A-L-E-P-A, and I'm from Shaler Township, just north of the city of Pittsburgh. I currently work full-time at Three River Center for Independent Living, and I do have health insurance. But I wanted to talk about a time in my life where that was not the case. In 1999, my now ex-husband and I were first separated, and here I was as a single working mother with two small children, ages 5 and 7. And although I was working for one of the largest healthcare providers in this state, because I was a part-time employee, I was not eligible for health insurance. And I have two chronic and fairly common health conditions that required constant maintenance. One was arthritis and the other was asthma. Well, my arthritis medication cost $99 a month. At the time, I only had a part-time job. My take-home pay was $769 a month. My ex-husband was paying the mortgage, but I had to pay the utilities. And in a big old Pittsburgh house, those utilities ran between $350 and $500 a month. So you can see, if I purchased medication, I wouldn't even be able to purchase food. Thankfully, because I worked for a physician, she did the best she could to let me know whenever the drug representatives would have samples of the medication that I needed, and we'd make do patching that together as best we could. However, there were times when she simply didn't have samples to give me. During those times, what I would have to do, because the pain from my arthritis was so severe that I couldn't hold a pen, I couldn't type, I couldn't pick up a file, I couldn't do the work that was required of me and get it done on time, I'd have to take the work home and work till 2 a.m., get back up at 4:30, get myself ready for work, walk my kids to the bus stop, take 2 buses and get to work. That went on for 14 months. I didn't really live during that period, I existed. And that's only part of the story because that's what happened with the arthritis. As for the asthma, oftentimes I couldn't breathe well enough to sleep unless I sat upright in a recliner chair, because the asthma medications cost over $300 a month. Now that I'm insured, things are a little bit better, but truthfully, not by a whole lot. Thankfully, my income has doubled, and in the social service world, that's about as high as it gets. But both of my daughters and I have asthma, and our co-pays for the asthma medications are $267 a month. The co-pays that I pay my physician for any doctor visits have risen from $5 to $20 per visit. And the premiums that I pay out of pocket for health insurance for just me are $160 a month. So I'm still looking at over $500 a month out of a $770 biweekly paycheck just to be able to stay healthy. Obviously, the healthcare system in the state of Pennsylvania and perhaps across the country is broken and needs to be fixed. I tell my story because many folks believe that everybody who's working can afford health insurance, and if you can't, then public assistance fills in the gaps. But I'm in a situation where I fell between the cracks and I didn't have that safety net. And there are many folks out there just like me. Thanks for your time.